Oral allergy syndrome is a food allergy, but it is fundamentally a problem with environmental allergy and the cross-reactivity between the fresh fruit or vegetable and the environmental allergen. So while patients come in and they can identify specific fruits and vegetables that cause symptoms, they often don't know what environmental allergens they might be allergic to. By doing skin testing for trees, grasses, and weeds, we can determine what environmental allergens they are allergic to and thus formulate how to treat them to fundamentally help them fix the problem with the fresh fruits and vegetables. For example, people who are allergic to birch tree might feel symptoms when they eat apples or cherries or peaches or plums. People who are allergic to timothy grass might feel symptoms when they eat tomatoes or oranges. Symptoms are often higher when the pollen counts are high. For example, in the height of spring or fall, patients with oral allergy syndrome might experience more symptoms when they're eating fresh fruits and vegetables. The best way to minimize symptoms is to simply avoid the food. However, in some cases, if the allergen might be concentrated in the peel, like in an apple, if you peel it, the symptoms will be reduced. Generally, with the fresh fruits and vegetables, if they are baked or processed, you won't have symptoms. So for example, baked apple pie or banana bread, or a processed version of something like tomato sauce rather than a fresh tomato will result in a reduction in symptoms. Patients with oral allergy syndrome will need to avoid the fruits and vegetables that they're allergic to in order to have no symptoms at all. Sometimes antihistamine medications can help with oral allergy syndrome, but it typically will not completely alleviate the symptoms. The best therapy for oral allergy syndrome is allergen immunotherapy, which is also called allergy shots. Since oral allergy syndrome is fundamentally a problem with environmental allergy, allergen immunotherapy can address it by fixing the immune system problem of reacting to the environmental allergens, and as a consequence of that, the symptoms associated with oral allergy syndrome will go away when someone eats fresh fruits and vegetables. So for example, if someone has symptoms where they eat fresh tomato or oranges and they get itchy mouth, tongue, and throat, we can skin test them and they will likely be allergic to timothy grass, which is the cross-reactive allergen there. If we do allergen immunotherapy and reduce and eliminate their allergy to timothy grass, they will then be able to eat the fresh fruits and vegetables like tomatoes and oranges with a significant reduction or a total elimination in the throat and mouth and tongue symptoms that they once experienced. Oral allergy syndrome is a food allergy with a fundamental problem rooted in environmental allergy, which can be very confusing for a lot of patients. Having an allergy expert at KCAA help you diagnose and treat this condition can result in a significant improvement in quality of life, not only in addressing being able to once again enjoy fresh fruits and vegetables, but also addressing and treating the environmental allergies that are associated with this condition.